So the message to stay home, save lives, protect NHS was in March. Things have changed. The hospitals have gone through a radical change. I've been a doctor 32 years. I've never seen more change as I have seen in the last 6 months. We, as a society, have fought back, adapted, and made a resource which is really, really fit for purpose.
We've created zones which are distinct from the COVID areas. So if you do present with cancer-related symptoms, you won't be going to an A&E department, you'll be going to a diagnostic hub where we don't have inpatients from the infection. And the same applies in the cancer centres in London. We're not mixing COVID patients with cancer patients, and patients in the hospital have been really carefully screened to make sure they don't have the infection.
Have you had a persistent cough, any sneezing or wheezing? Have you had any muscle aches or pains? Any loss of taste or smell?
We have great testing facilities and we'll test people who we feel are at risk.
So what we created is a COVID-protected green hub. Essentially, it's a watertight area within a hospital which has got separate entrance, separate exit, and does not mix with the rest of the hospital. Before the patient comes to this hospital, they will have their questionnaires and they will have their swabs. Then you have got a second tier of protection, which is temperature check and symptom check, etc. So the third layer of protection is to do with mask, is to do with our hand washing and creating distance. So we have got layers and layers and layers of protection. We are obsessed about your safety.
Late March, April, I see a consultant who found something. He'd done further investigations and then he found out it was cancerous. But early diagnosis, I'm not a specialist, but it seems to be the key to it all. The surgery was a week ago, so I'm hoping the next few days to go home, You don't know what the outcome is with the COVID, but you know what the outcome could be with the cancer. They're putting everything in place for you anyway. For me to come in here, I had to have the COVID test. And there's a continuous cleaning, there's a spacing, so I don't know how much more they can actually do.
We have a very clear policy on how many patients are allowed into the hospital, on how many doctors we can put into a clinic, on how many patients we can put into a waiting area. So there's a huge amount of work that's taken place. And indeed, I think the chances of picking up the infection in the hospital environments that we have to treat cancer are much lower than going to the supermarket.
Individuals coming into hospital, they might be anxious, but after settling in, seeing that staff are wearing their PPEs, doing their hand washing, and they see that the care is not compromised, the anxiety becomes less.
After I had my radiotherapy at Barts, I had to go for follow-up scans at Homerton. I was anxious because I didn't know how different it would be since COVID, but they had procedures before you entered the hospital. So temperatures were taken and I could see it was only the patients that needed to be there that was there. And I felt very comfortable.
I hope that residents of North East London get this message that we are open for business. You're not going to put yourself at risk. COVID-protected hubs are reality and we can treat you safely.